Hello dear students, let's learn some of the spotters related to upper limb. Let's see the first question. The sub-questions are A. Identify the structure pointed with yellow arrow. B. What is it a branch of? C. Name the muscles supplied by it. So from the figure you can understand that this is left arm and the structure is belonging to the brachial plexus. Now we can see an M pattern of brachial plexus nerves. So what is that? The M pattern, the lateral aspect of the M is formed by the lateral cord of brachial plexus, whereas the medial aspect is formed by the medial cord of brachial plexus. And in between, the V-shaped part of the M is formed by the medial and lateral roots of the median nerve. So you know that the lateral root of median nerve is from the lateral cord of brachial plexus. So the other structure that is present at the lateral aspect of the M should be also from the lateral cord of brachial plexus. Now the medial root of median nerve is from the medial cord of brachial plexus. So the other nerve that is present or the medial aspect of the M should also be from the medial cord of brachial plexus. Now in this figure you can see that the structure that we initially told, the pointed structure, is piercing a muscle. So the musculocutaneous nerve is the nerve that pierces the coracobrachialis muscle. So like that you can identify the M pattern. So that means the musculocutaneous nerve is piercing the coracobrachialis muscle. Then so that means that is from the lateral cord of brachial plexus. Then you have the lateral root of median nerve. Now the medial root and lateral root of median nerve join together to form the median nerve as such. Since the medial root of median nerve is from the medial cord of brachial plexus, when you trace back you can see the medial cord, and from the medial cord you also get the ulnar nerve. That's how the M pattern is formed, and that's how you identify it in the cadaver. We got two answers. That means the pointed structure is the musculocutaneous nerve. So how it is identified? By seeing that it is piercing the coracobrachialis muscle. Now it is a branch of the lateral cord of brachial plexus, that also we have seen. Now we will see what are the other muscles supplied by it. The muscles supplied by it are remembered by a mnemonic BBC. That means B stands for biceps brachii, B for brachialis, and C for coracobrachialis. So these are the three muscles supplied by the musculocutaneous nerve. And the nerve to brachialis as such will give articular twigs to elbow joint and also a nutrient branch to the humerus. So we have seen that the musculocutaneous nerve is a branch of the lateral cord of brachial plexus. So what are the other branches of lateral cord? That is remembered by a mnemonic LML. So that is lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. What is the fate of the musculocutaneous nerve? So after supplying all these muscles, it will pierce the deep fascia just below the elbow and continues downward as the lateral cutaneous nerve of forearm. Now we'll see the second question. The first sub-question is identify the colored bone red, and B is how is it formed and write its clinical significance. So you can see the colored bone is pisiform bone. So it is the carpal bone is the smallest carpal bone. So you can identify the other carpal bones. They are arranged in two rows, that is proximal row and distal row. Proximal row from lateral aspect onwards you can see the scaphoid, lunate, triquetral and pisiform. And the distal row from the lateral aspect you can see trapezium, trapezoid, capitate and hamate. So you have identified the bone as the pisiform bone. Now how is it formed? It is a sesamoid bone in the tendon of flexor carpi ulnaris muscle. Okay, so it's a sesamoid bone in the tendon of flexor carpi ulnaris. And what is its clinical significance? It is ossified last. So it's a carpal bone to ossify last. That means it ossifies by 12 years. Ossification is a bone formation. So it is completely formed by 12 years. So what is the medical significance? So it is of medico-legal importance. That means if you happen to see an X-ray with absent pisiform bone, that means the child is belonging to an age group less than 12 years. So you can see two x-rays here. In the first x-ray, we'll see the carpal bones. This is the lateral aspect of the proximal row. You can start counting. There is scaphoid, lunate, triquetral and pisiform. Then in the distal row, you can see the trapezium, trapezoid, capitate and hamate. So this belongs to a person more than 12 years of age. See the second x-ray, you can see the radius ulna, the lower end. Now we can count the carpal bones, scaphoid, lunate and triquetral in the proximal row. You are not seeing the pisiform in the proximal row. In the distal row, you can see the trapezium, trapezoid, capitate and hamate. That means this X-ray belongs to a child less than 12 years of age. So that is the medical legal importance of the pisiform bone. Now we'll see the third question. The first sub-question is identify the bone along with the red colored part. B. Name the joint and its type formed by articulation of the circumference of the colored part. So that question is very important. So this bone is the radius. You can identify with the head and the radial tuberosity. So the head of radius is the colored part given here. Now what is a joint formed with the circumference of the head of radius? So the circumference of the head of radius articulates with the radial notch of ulna to form the superior radio-ulnar joint, which is a pivot joint. So in the first figure, you can see the circumference or the peripheral margin of the head of radius articulates with the radial notch of ulna and along with the annular ligament. So the articulation is between the head of radius and an osteofibrous ring formed by the radial notch of ulna and the annular ligament that is forming the superior radio-ulnar joint, which is a pivot joint. But in the second figure, you can see the upper surface of the head of radius and you can also see the capitulum of the humerus. So the upper surface of the head of radius articulates with the capitulum of humerus to form the humeroradial part of the elbow joint, which belongs to the hinge variety of joint. The fourth question is identify the pointed structure with green arrow, and the sub-question next one is give its nerve supply. So the pointed structure is the brachialis muscle, and now what is the origin of brachialis muscle? It is arising from the lower half of anteromedial and anterolateral surface of the shaft of humerus, and it gets inserted into the anterior surface of the coronoid process of ulna. So what is its nerve supply? The nerve supply of brachialis is very important because it has got a dual nerve supply, and that is remembered by a mnemonic Mr. Brachialis. So when you're writing the Mr., you will write the M as capital and R as small letter. So the main nerve supply is provided by the musculocutaneous nerve. So they provide the motor branches, whereas the proprioceptive fibers are carried by the radial nerve. So these are the two nerves that supply the brachialis muscle. Now what is the action of the brachialis muscle? It is a chief flexor of the elbow joint. So now we'll see the last question for the day. A. Identify the pointed structure with blue arrow. B. Write its extent. So the pointed structure is the cephalic vein, and you are seeing the delta pectoral groove here. That is, you can see the deltoid muscle here, and this is the pectoralis major muscle. So this region is delta pectoral groove, and this is a cephalic vein in the delta pectoral groove. So in the first figure, you can see the dorsal venous arch, that is a venous arch present of the dorsal aspect of the hand, and you can see the cephalic vein is formed by the union of dorsal digital vein, which is from the radial side of the index finger, and also the veins of either side of the thumb. They join together with the lateral end of dorsal venous arch to form the cephalic vein. So after it ascends up, it is present in the delta pectoral groove, and then at this triangle or the delta pectoral groove, the vein takes a sharp turn backwards and it pierces a clavipectoral fascia, where it enters the axilla and terminates in the axillary vein. So that is the fate of the cephalic vein. So these are some of the spotters for the day. I'll come up with more spotters in the coming days. Thank you.